morning. Good morning. Welcome to our weekly COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for Shasta County Health and Human Services. I wanted to apologize in advance that we do not have a sign language interpreter today. We will have this meeting captioned by tomorrow afternoon, well, probably early tomorrow, and posted on our Facebook page and also our YouTube channel and our website. As of October 12th, Monday, we have had 1,597 confirmed cases of COVID, including 95 from Monday. We had 743 negative tests on Monday for a total of 53,928 negative tests and a total of 55,525 total tests. We have 4 people in the hospital, including none in the intensive care unit. We have 176 people on isolation, which are people who have tested positive, and another 380 in quarantine, which are people who are close contacts of those who have tested positive. We have had 29 deaths so far. We have somebody who is not on mute. Could you guys all check and make sure that you have your phones muted or your phones muted? I'm going to try and do that myself because that is not changing right now. Oh, that's better. Okay, awesome. Thanks, everybody. Okay, so with us today, we have Robin Schurig. She is our Public Health Branch Director for the Health and Human Services Agency. Matt Pontes is the CEO for Shasta County. Dr. Karen Ramstrom is our Shasta County Health Officer. Dean Germano is the CEO of Shasta Community Health Center. Does anybody have anything they would like to start off by sharing before we move to media questions?
Good morning, everybody. I can just give a quick update on the 2 areas that we've had some outbreaks that we've been speaking about over the last couple of weeks. In terms of our skilled nursing facility, Windsor, we're continuing to work really closely with them and see improvements. The numbers are trending down, so they're going in the right direction. And so we know that it's going to continue to take some effort. And, you know, what we've recognized with skilled nursing facilities in particular is it's sort of a waiting game because you implement measures and then, you know, you just sort of have to monitor going forward. But a lot of effort going in to support this facility from ourselves and state. And then our other big area that everyone is well aware is with the outbreak at Bethel School of Supernatural Ministry. Again, continuing to work with the leadership there. They've shared with us many measures that they've implemented, including going to distance learning as of October 1st. And that's continuing, and messaging to their students about staying at home, and all the prevention messages that we continue to share. And so we, again, will continue to monitor that. Exposures that have happened prior to that may continue to pop up, but we're hoping to see continued downward trend. And again, we will see some upticks if there's efforts to do additional testing, that kind of a thing, which happened with their last mass testing. So that's expected. That's good. We identify additional cases. We can isolate them, identify close contacts, and further reduce the spread. And so, again, these situations are sometimes just a waiting game as we implement those measures and continue to kind of have that outbreak contract down with those interventions. So those are the only updates. Oh, actually, one more. I do have one more, is that even though we have seen these 2 pockets where we've seen this additional attention that public health has been involved to really try and reduce the spread, there continues to be spread, and at a higher proportion, you know, I guess relative to our total numbers, pretty much the same. And so there's other spread happening out there in the community that we've seen all along, you know, that previously was at this low level and has gone up a little bit just as we've had more numbers overall. And so we continue to recommend, you know, that our businesses and other sectors are really diligent about those prevention measures, those modifications to reduce capacity and exposure, and using those prevention practices in a rigorous manner to prevent any exposure to public visiting those locations. And all of us, when we're out and about, keeping our distance and wearing our face coverings to protect those around us. So I think that's all I had this morning. Thank you.
Thank you, Dr. Ramstrom. Anybody else? All right, we are ready for media questions.
Well, let me jump in with either Dr. Ramstrom, maybe Robin, I'm not sure. But, you know, there seems to be increasing resentment in the community toward Bethel Church. And fairly or unfairly, their School of Supernatural Ministry is being blamed for this spike in cases and pushing Shasta County into the purple tier. Is that true? Is that fair? Is that accurate?
So I think, as Karen stated, there are, a number of cases coming from that setting as well as the skilled nursing facility, but there has also been an increase in the community at large. So, which numbers do you want to blame on the increase? They're certainly not, all of our cases. There are other cases out in the community as well. And so that's why it's really important for people to, continue to distance and wear their masks and stay home when they're sick and all of the same things that we've been saying. So it's not entirely due to those settings. They've just contributed to the numbers.
Thank you. Is the total number of cases from Bethel still at 274? Or go ahead, Dr. Ramstrom, if you had something to say.
Yeah, I was just going to say that, this is happening with BSSM, but it can happen at any location where we have people who are in close proximity, whether that's because of housing or they're in a school setting, what have you. So none of us are immune. And so what happens is once this gets going, it's really hard to intervention has to happen quickly. And any of our settings are vulnerable because we don't have immunity. And so I think that's important to keep in mind, that all of us continue to be diligent with those measures. We've seen success in other settings with this. And so, and we're all learning as we go. But BSSM, I think they're just in a sort of a unique circumstance because of the way that they have their housing and the way that they have people coming in from outside the community. It's just the nature of the beast. It happens in any college. It's happening in colleges across the nation where people come from different areas and then you have shared housing. And so my hope is that we're able to do some intervention and get some more rigorous practices in place and get a handle on this thing, and we'll be able to turn it around. But no setting is really immune. They're just particularly vulnerable to that, as are other comparable settings.
Thank you. What's the total number of cases from Bethel now?
Carrie, do you want to share what you had yesterday?
So I don't have an update from yesterday's figure, which was 274, I believe.
Okay, thank you. Shasta County is being reported in some places as having the highest positivity rate in the state. Is that really true? On the website, the state website, it looks like Imperial County is higher. I just want to be accurate here.
Go ahead, Robin.
So I was just going to say, whatever is on the state website is the most accurate. And so if it's showing that Imperial is higher than ours, then it is higher. The other thing I was just going to mention is, as Karen stated earlier, with a setting like BSSM doing some mass testing to try to identify more cases, it's reasonable to expect that our positivity rate would be higher because we're testing more people, but we're testing specifically in a setting where we're expecting to see cases. So that's one explanation for why our rate is higher than a lot of other places.
Thank you. I've got two more questions and I'll be done, everybody, I promise. How many tests can you process in a day? Can be processed in a day, whoever's doing it? The reason I ask is I've been told there's kind of a bottleneck where only so many can be done, even though there are more, in the pipeline.
So there's a lot of different places that are offering testing, and they all are using different labs. So we run a certain number, and I'm not sure what that number is. I don't know if anybody else on the call knows that number, but in our lab, we can do a certain number per day. But then, like, this testing site out at Shasta College uses a different lab, and so they send those off to a variety of different labs, I believe, to have them processed. And then, for example, the BSSM testing, they contracted with a company who sends those specimens down to a lab down in Southern California. So each lab has their own capacity, but there's a variety of different labs working to process tests. So I don't know what the total number would be.
But you don't have a problem in processing those numbers when they come in, as far as there's not a bottleneck at the county.
So for the specimens that come into our lab at the county, no, because we don't take in more than what we can process. And Karen may have more information about how many we can process in our lab, but it's a pretty high number, I believe.
Yeah, and I don't know that we've actually bumped up against that maximum number. We do a large volume, and we have other strategies we can use, you know, and we monitor that and kind of prioritize as well those that need faster turnaround. And, you know, I don't think that we bumped up against that maximum number so far. I think it's important to remember too that there's a lot of different pieces within testing, and so I think the other area that we're really working on is testing is a whole area that we have a lot of planning going on as that area is evolving. So specimen collection, how do you do that safely? Can we actually have that readily available throughout the community? And the different types of tests are evolving too, and so you know, I think that's going to evolve over the next few weeks. We have some test resources coming in to the community that we're looking at how to share those, how to make them available in case of an outbreak. And so we're doing planning around that right now. I know that a variety of clinics in the community have ordered their own point of care machines. And so it's an area of attention, and that we're doing some planning and engaging and planning to further engage our healthcare community around that moving forward.
Thank you. My last question, I promise. Related to schools, are schools completely separate from tiers? Because in Butte County, they're saying, well, they were granting waivers and they got into the red zone, and so now they're able to go back in person. I thought in Shasta County, I've heard it said that they're completely separate, that the tiers have nothing to do with the schools.
Yeah, so we have said that because that was our understanding at the time, and we have since learned that there is one connection with the tiers, and that is that if we move into the purple tier, then schools that have never been open, that didn't open at all since the start of school back in August, cannot then open. And so in Shasta County, we only have 3 school districts who have been on completely distance learning this whole time. And so if they wanted to move to either hybrid or in person, they wouldn't be able to do that if we were in the purple tier. But those schools are not planning to open anytime soon anyway, so it really shouldn't impact our schools, but that is one way that it turns out the tier system is connected to schools.
So that's it. All schools that are open now can remain. That when Shasta County goes into the purple tier, then it will not affect the schools at all.
Correct.
Thank you. Thank you, everybody, for your patience.
Yeah. I just wanted to make a point about the point of care testing, and we're one of the organizations that finally received some cassettes for the COVID test from 2 manufacturers, BD and Abbott, and we have their machines as well. But the complication there is those tests are limited for us, limited to those people who are symptomatic. They're approved for that purpose, and only in our case for our patients. So the worry as well is that we have a decent supply at this moment that took almost 3 months from the point of ordering to get here. We don't know what the supply chain is for next month. So, you know, how do we manage this inventory and this really important piece of what we can do to help our patients in our practice? But it's really complicated by issues like the supply chain. And I think that's true for other practices that are starting to get some of this point of care testing.
Yeah, absolutely. Thank you for sharing that, Dean. You know, I agree with you. You know, there's many of these, so you have a machine, but then you're on an allocation of how much supplies that you get at a time. And it's so I think, you know, we are very concerned about that and doing some additional planning at our DOC. And I think the more options we have, the better. And so as those, some providers might have supply, others might not. But we're kind of in the process right now of trying to do an assessment of what that looks like. we are hopeful, to continue the state testing site. The state's looking at those contracts and what that might look like, maybe having some more mobile capacity within that as that evolves over the next couple months. In addition, I think what's going to be really helpful is the state is actually building a lab, a PerkinElmer lab, that will run these tests, the kinds of tests we're doing right now, these molecular tests, these PCR tests. And so, it's going to double basically our capacity we have right now. And so we'll have faster turnaround. And so even if that point of care machine in your office, you don't have supplies, then, another strategy would be collecting the specimen and using that state resource. And so I think all of that's going to sort of start coming together over the next few weeks. And it's probably going to change over time and as new technology comes along. And so it's an area that we're really paying a lot of attention to and look forward to engaging our community partners in that conversation so that we can be nimble and be able to direct those, kind of know where we have resources and direct individuals as we go forward.
All right. Any questions?
Hey everyone, this is Alexandria Williams with KRCR TV. I was interested in hearing from Ms. Ramstrom or Ms. Schutte or anyone else who might want to add to this question. I was really interested in hearing a kind of a quick, what is this transition going to look like exactly? I know we kind of touched on it here earlier in the meeting, but moving from the red tier to the purple tier, I know I've heard from a lot of community members, they're really nervous about that move. And so what can you say to just kind of break it down? What is that transition going to look like for the community as a whole, really, and for our local businesses?
So I'll start and then anybody else can add if they would like. So really the transition from red to purple means that there's further restrictions on various sectors of businesses. Some businesses will have to close, some businesses will have to have their services provided outdoors only. Others will just have to reduce their capacity, things like that. So it's different for each sector. And so we have been reaching out to businesses to make sure that they're aware of that information. And they do have, so if we move into the purple on Tuesday, they will have until Friday to make those adjustments. And so, yeah, really just been doing outreach and education. And then just a reminder that the whole purpose of the state's tier system is to really encourage people to stay at home more and not, go out and mix and mingle. So the purpose is to try to stop the spread of disease. And so that is the reasoning behind why there are these further restrictions when our case rate puts us into the purple tier. So really just trying to encourage that message in the public.
We also, on shastaready.org, if you click on Roadmap to Recovery, you can see the breakdown of what that means for each of the different sectors, what the changes will require.
Yeah, and I would just add, it's an opportunity to kind of get back to those strategies maybe that we used more early on back in the spring. So doing curbside pickup for retail and takeout from restaurants, and so that we're continuing to frequent those businesses, but accessing them in different ways. And so more of those options hopefully will be utilized and made available. And yeah, I think I also recommend, looking at that at the website tool is really, really helpful and is more robust than it had been historically. And so there's a link to that on Shasta Ready.
Thank you, ladies, very much. So for my last question regarding the purple tier, would you say that we saw this coming in weeks ahead?
Yeah, I mean, our data has qualified us for the purple tier for a couple of weeks now, but we just are required to be in one tier for at least 2 weeks before they'll move us to a more restrictive tier. So yeah, the writing's been on the wall for a couple of weeks now, I think, that we're headed to purple.
Thank you, everyone, very much.
Hi everyone, it's Anna from Action News Now. Just had a couple of questions here. First off, we've probably seen the video that's been circulating around social media regarding some Bethel leadership and response to the masks. What does public health have to say about that? Basically, saying masks don't work, but we've had the same message for the past couple months that wear those face coverings, do what you can to help reduce the spread of coronavirus.
So I would just say that our concern with Bethel right now is really focused on BSSM, and we've been working with their leadership, and they assure us that they are encouraging their students to, stay home and wear masks when they do go out and maintain their distance. So we're encouraged that at least within the BSSM community, that message is being pushed out to the students by their leadership.
Okay, to follow up on that, sorry.
Sorry, Anna.
Okay.
I want to add that there is only growing evidence around the benefits of face covering and mask use to mitigate this spread of this virus. And so we really encourage people to do that. It's easy to do. If you can't use it for some medical condition, it's sort of like if you can't get vaccinated, then the rest of us need to. And so it sort of just needs to become part of our daily practice, and it can make a big difference, and it can allow us to open up more. That's the thing to keep in mind. Keeping our distance from other people as much as we can and wearing that face covering is going to allow us to get out of the purple, get back to the red, and hopefully the orange. So I would really encourage people to not pay attention to that misinformation and, give it a try.
This is Dean. I just want to add that from the medical provider standpoint, this whole pandemic has been extremely stressful on them. And it's disconcerting to see leadership in any role disavowing the basic public health tenets of distancing and masking. So to the extent that Bethel's leadership needs to step up, I think it matters, because it matters to the people who are taking care of sick people. And in addition to trying to avoid more downstream impact. So, from my organization's standpoint, what we've seen has been very disappointing. And we stand right with public health on this thing about masking and basic, simple things that can make a difference. My 2 cents.
Awesome. Thank you for that. Also, just kind of wanted to follow up on that too. Dr. Ramstrom, you mentioned, it wasn't just the skilled nursing facility and BSSM, they're contributing to the spread, but you also mentioned other locations, other spread is coming. Can you just specifically, list examples or just point out where this other spread is coming from?
I think it's just a higher volume of what we've seen historically, and our epidemiologists will continue to look at that as we kind of continue to get caught up on our case investigation. It's a lot of data to aggregate, but there are things like somebody traveled for work, or someone traveled for to see their family member, or somebody came to visit, or there was a gathering of some sort. A lot of close contacts of confirmed cases from these, from whatever circumstance. And so it's just more of the same that we've seen historically throughout the course of the outbreak. And so hopefully we'll have more data on that soon. But I haven't seen any indication of other types of trends. It continues to be those kind of key areas of vulnerability that just kind of keep trickling along. And they're a little bit higher now just because we seem to have more a little bit more transmission than we had previously.
Also, just had a couple more questions here. Sorry, just had a couple more here. You mentioned point of care testing. I'm sorry, can you just elaborate what is point of care testing?
You want to talk about it, Dean? You guys are doing it. Thanks.
You're the one with the MD. Why don't you explain it?
So the point of care is really at the doctor's office, and so it's something that can be run in that setting versus having to be sent out to a lab that runs it at some distant location, whether it's in the community or even a different part of the state. So it provides a faster turnaround for a test that can be used to do just clinical decision making, or in this case, even decision making around whether that person can be around other people and that kind of a thing. So, so that's what it is. That's the idea, is that we get more and more technology that will be moving us in that direction. but it does need to be used hand in hand with tests that we know are, they're sort of our backup most reliable tests, which would be the ones that we're doing right now in our public health lab, and that are sent out to commercial labs for that kind of testing.
Yeah, the time is, to get a result is about 15 to 30 minutes. It's not as precise as the PCNR tests. So, it has its place, but as we saw in the White House, those rapid tests don't do it all, right? You still need to do the other things. So, yeah.
Also, to follow up on that, because you were just talking about it earlier, is like the clinic or any other hospitals kind of seeing a shortage in this point of care testing kit?
So it's been an issue. This has been the situation all along. And as new technology comes along, the supplies for those types of technology are provided on a limited allocation. So they're distributed and you only get so much at a time because there's just not enough to have an unlimited supply on hand. And so it's sort of the nature of this since the beginning of this pandemic. And so as new machines come along, the same situation is happening. So we have a little bit better supply chain with some of our testing that we've been using for a while. And actually we have diversification of the types of the same sorts of tests with different machines, at least in our public health lab. So if we run short on one set of reagents, we can use a different machine. And so it's just the nature of one of the many challenges with testing capacity and in this pandemic.
So to also follow up on that, on public health's perspective or expertise, would it be more encouraged to, use that testing site we have set up at Shasta College instead of, using the rapid testing kits?
So they all have their own, all have sort of their own utility, a different purpose. And the more options we have available, the better, because when we have an outbreak, then the state testing site is going to be overwhelmed if people are going there because they are worried they were a contact or they have symptoms. We do a lot of organizing and helping people to get tested at a couple drive-up sites. And Shasta Community Health Center, under Dean's leadership, has made that available very generously, and so that we can get people who have been exposed to have a specimen collected quickly and we can run it in our lab. So we have a variety of places that we're directing people to get tested. And so I think the more options we have, the better. And then in the clinical setting, as a provider seeing a patient, if they have tools available that they can get fast turnaround that's reliable because we're using it in an appropriate manner, then that's good. So we're testing for a variety of different reasons, and having those variety of options available is really important. And the mix of those and enough capacity in each of those areas is what we're looking at moving forward.
Can I ask a question? This is David Benda with the Record Search Site. I want to follow up with Dean. You were commenting about how you were disappointed with Bethel's leadership and the statements they've been making, or the video and the statements they've been making about, that masks are useless. I would like you to comment, if you have one, your thoughts on, because the distinction was made between the church leadership and the School of Supernatural Ministry. Your thoughts on the School of Supernatural Ministry and what they've done since the students have come back and up until this point. How you think they've handled this?
All I would add is I can only go by what public health is sharing with us, that they are taking active steps to do what's necessary to protect their students and the community. So to the extent that they're doing those things, I'm very grateful. I just think that it doesn't help when leadership in whatever role, whether it be the church or anywhere else, basically disavows the benefits of some of these practical measures. We cannot get back on our feet until we get through this, and those are the steps you need to do. Mask, distance, wash your hands, basic things that shouldn't be so oppressive. We've politicized, and it's infuriating, particularly for those of us working in the healthcare side of things where we're close to this, and we're dealing with the repercussions of people failing to do those things. So leadership has a responsibility, and I hope with this outbreak that maybe there's a change. I'm glad that the School of Supernatural Ministry, they're doing their thing for their, and it sounds like they are, so I'm happy to hear that. But I think it helps when leaders at all level basically are reading from the same playbook here. That's what we need to do. If we really want to get a handle on this, that's what we need to do.
Other questions? I have a couple questions from Donnie. If Dave, do you have any other questions?
I'm done. Thank you.
All right, thank you. So Donnie's audio is not working, but she has sent the following questions. What is the current count of Bethel Church positive COVID cases? And in light of the church continuing to do conferences and reports of BSSM students holding large off-campus gatherings, does HHSA have any plans for enforcement at the church?
So far, we have not detected an outbreak among the church at large, as opposed to just in the BSSM setting. So we're not tracking those numbers. We could go and look at how many have been associated with the church, but I don't have that number offhand because we're not noticing an outbreak there. As far as enforcement, we follow up on anything that we hear about that's outside of what the state is requiring at that particular moment in time. And so as far as we know, the church has only been holding outdoor services. There was obviously the conference that was on their social media, excuse me, but we didn't know about that until after the fact. So if we had known about it in advance, we would have reached out to them and let them know that that's not something that's allowed at this point in time, as we do with other organizations and events.
Right, and her next question is, what can you tell us about outbreaks at other skilled nursing facilities, specifically the Vistas?
Sure, I can speak to that. So we're working really closely with them. They're actually doing a very good job and had been implementing many of the best practices before we even engaged with them. They are doing what's recommended, doing testing, they're isolating individuals and taking all those necessary precautions, and we're having regular communications with them. And so we're, it's like I said earlier, whenever you have an outbreak in any of these kinds of settings, you implement those measures and then you continue your rounds of testing. And it can take a while because you do that once a week, and so on staff and residents, and so then you get those results. And so unless you have people who are symptomatic, you might not see the outcomes of your interventions for a couple of weeks because you're doing that sequential testing, that serial testing. And so but we're hopeful. I mean, they're doing a great job, and we're continuing to engage with them and having going to visit them and making available PPE if they need it and that kind of a thing. So it's headed in the right direction, but it can take some time to see those results.
Any other questions?
Sorry, I had one more follow-up question. I just thought of it right now. This one is for who's ever able to answer. Just wanted to clarify here, when it comes to BSSM again, where we're seeing this outbreak in cases, is it still, what we've said the last couple of weeks? I just want to make this clear. Is it still, we believe it to be from, students living in the same environments, interacting with each other, things like that?
Yes, I don't think anything has changed in terms of where we're seeing the spread. So yeah, it's mostly close living quarters and, students getting together with one another. We haven't seen, they're on distance learning right now. So obviously right now we haven't seen spread in the classroom, but even before they went to distance learning, we were seeing the spread happening mostly outside of school.
I had a follow-up question. I guess this would be for Robin, since she addressed this. I was understanding that the conference that was held at the time it was held was when we were in the orange, and Bethel said that while they had 300 people, they were separated into 3 smaller groups in 3 separate buildings, and that was, because they did that, that was okay. Have you guys looked into it more closely and you found something else, or what?
We have not looked into it more closely because, as I said, we didn't know about it until after it had already happened. So we don't know the specifics of how they arranged it or what guidance they were looking at or what modifications they made.
But I thought you said had they reached out to us, we would have told them it's not, you can't do this.
So Dave, when you and I talked about it the other day, you had indicated that it was 325 people in the same building. So this is the first that I think that we don't know the details of what happened, but 325 people in one building would not be allowable. It was 200 or fewer. If the situation was different, then we may have a different answer.
Well, and then in my story today or yesterday, they said that it was, which I reported, it was 325 people separated into 3 different smaller groups in different buildings.
All right. Any other questions?
Not the media, but I'll ask it. To our public health colleagues, you had a drive-through shot clinic on Saturday that, by all accounts, was really very popular, but I can appreciate was very taxing because you were a little short-handed. But I'm curious, in the context of the COVID and the pandemic and all the rest, can we gather anything from the demand for that service? Did we learn anything from that speaks to the connection between the two?
Yeah, it's a great question, Dean. And I think our community is interested in making sure that they're safe, their families are safe, they're taking all the steps that they can. And several people that I talked to that day said, yeah, I always do your flu shot clinic. And so this is great. And it's good to see additional people here today. And so I think people are trying to do what they can to be safe moving in to this respiratory season. And so, which is wonderful, that people wanting to take care of themselves and their families. So we were really, really pleased.
All right. Any other questions?
Are there other clinics planned?
We don't currently have any more drive-through clinics planned, but we do have clinics here at our public health clinic that are available by appointment.
Thank you.
And we're seeing signs all over the place for flu shots throughout our community, so it should be easy for folks to get those. Any other questions?
Just to make sure I had this correctly, Miss Robin, you said they have until, businesses have until Friday to make those adjustments for the purple tier. Is that this Friday?
No, that would be if we move into the purple tier next Tuesday, then they would have until that Friday. So they have 3 days after we move into a new tier to come.
Okay, I see what you're saying. Okay, thank you very much.
Can you hear me? This is Donnie.
Yes.
My question is a follow-up to Mike's about the tiers and the Bethel numbers. If we took out the Bethel positive case numbers, what tier would Shasta County be in?
Haven't done the math, but off the top of my head, I'm guessing that we would still be in the red and headed to the purple. I think there's been a significant increase in the community as a whole, in addition to the BSSM cases.
Thank you.
All right. Any other questions? Donnie, if you wanted to look at the, there's a breakdown of what the different, what the numbers are in each of the tiers, and it's pretty restrictive. So I can point that to you offline. Any other questions? Okay, thank you everyone for being here with us today. We will see you again next week. Have a safe and healthy day.